If you're divorced, you might still qualify for Social Security or Medicare through your ex, and it could save you thousands in retirement. Let's dive into how that works. Welcome back to Medicare Happy Hour, the most fun you'll have on the internet while talking about Medicare. Today, I am enjoying a whiskey smash while we dive in. So before we dive in, I want you to know that you may be eligible for Social Security benefits through your ex-spouse if the following applies to you. Your marriage lasted at least 10 years, you're currently not married, you're at least 62 years old, and your ex-spouse is eligible for Social Security. All right, so to start looking at what the actual benefits look like, you could receive up to 50% of your ex-spouse's Social Security benefit at your full retirement age. I'd recommend that you go online and look up what's your full retirement age because it depends when you're born and it varies. It won't impact your ex-spouse's benefits, or if they're remarried, it won't impact their current spouses. And if your own benefits are higher, you'll receive that amount instead. It doesn't make sense to pool the less amount, obviously. And if your ex hasn't started collecting benefits yet, you can still apply through them. You just need to be divorced at least 2 years. All right, so before we dive into the application process, I want you to know that we have an entire video on this. So go ahead and check out our YouTube page, and we have a video where we walk you through exactly how to apply for Social Security and how to do all of this online. But, the application process, essentially what you need to do is go to ssa.gov. You'll need your birth certificate, your marriage certificate, your divorce decree, the final one. And it's helpful if you have your ex-spouse's Social Security number as well. Now, switching gears to Medicare from Social Security and how divorce impacts that, quick reminder, Part A is your hospitalization. Part B is medical or doctor side of things. So as a reminder, Part A, there's no premium if you or your spouse worked for 10 plus years. And even if you didn't work enough, you still might get it based on your ex-spouse's work record and kind of the way that that's all counted. So if you meet these criteria, you may not pay a premium. If you're over 65, you're currently unmarried, you were married at least 10 plus years, your ex-spouse is eligible for Social Security, or they've worked their 40 quarters, which is 10 years of work. But if you remarry before the age of 60, you're generally disqualified. So I'd recommend you check that out. Now, Part B, as I just reminded you, this is your medical insurance, so the doctor side of things. So this is a standardized monthly premium. There is some increase. If you are a higher earner, you generally pay more for your Part B, and they do look back on the last 2 years of income. And being married or divorced on Part B really has no impact. One last tip about Medicare that's worth mentioning is I would highly recommend you to check out your options when you are turning 65. If you enroll during your IEP, which is the 3 months before and the 3 months after the month that you turn 65. Or, if you lose employer coverage due to divorce, you can qualify for a special election period, which helps you avoid those late penalties. So then the last thing we do want to cover today is survivor benefits. If unfortunately you lost your spouse, in looking at Social Security, if your ex-spouse passes away, you may be eligible. You typically qualify if you were married over 10 years, you're at least 60, or 50 if you're disabled, and you haven't remarried, or if you did so after the age of 60. And on the Medicare side, widows may still qualify for premium-free Part A based on the ex-spouse's work record. Frankly, Social Security and Medicare can be confusing, and divorce just adds a completely other layer to that. Really, the truth is that you may be entitled to more than you realize or you think that you are. I'd recommend consult with a financial advisor, Social Security, reach out to them. And when it comes to Medicare, our licensed advisors are here to guide you through this at no cost to you. Give us a call. We're happy to help.